Shaving is quick, but waxing gives lasting smoothness. Or does it? Are you tired of razor bumps? Or maybe you're wondering if waxing is really worth the pain. Stay tuned because by the end of this video, you'll discover which method gives you the best results, saves your money, and keeps your skin smoother for longer. Is waxing better than shaving? If you're looking for smooth legs, a hair-free bikini line, or a clean face, you may be wondering whether you should shave or wax. The differences between waxing and shaving. Waxing is a method in which cold or hot wax is applied to the skin to remove unwanted hair. In this method, wax is directly applied to the skin or using cloth or paper strips with wax to remove unwanted hair. Wax is then applied and quickly pulled off, which removes hair from the root. Shaving involves using a razor. Razor may be manual or electric to cut the hair at the skin's surface. There are many differences between waxing and shaving, and these differences may help you make the right choice for your skin. Pain and discomfort. Generally, waxing hurts more than shaving, especially for those people who have sensitive skin. This is due to the fact that hair removal by waxing involves painful extraction of the hair from the roots. When waxing, especially if it's your first time, you can experience redness, discomfort, or even little bleeding. While shaving is usually painless, improper technique can result in cuts, nicks, or razor burns. Skin irritation can also result from shaving, particularly if the skin isn't adequately prepped or the razor is dull. Hair regrowth. The hair takes longer to grow back after waxing since it is removed from the hair follicle. Your skin may feel smoother for a longer period of time after results that could last 4 to 6 weeks. Waxing causes hair to regrow more slowly, which tends to make it finer and softer and reduces the likelihood of unsightly stubble. Shaving merely removes hair from the skin's surface, which speeds up hair growth. In a matter of days, new hairs could emerge, and when they do, they usually have a blunt tip that feels rougher and spiky. Effects on your skin. Dead skin cells are removed during waxing, giving the skin a light exfoliation. Additionally, frequent waxing can weaken hair follicles over time, which may eventually reduce future growth and thickness of hair. Though not as much as waxing, shaving also exfoliates the skin. Ingrown hairs, razor burn, and pimples can also result from shaving, especially if your skin is sensitive or you don't use shaving cream. Convenience and time. Particularly when done in a salon, waxing sessions take longer than shaving sessions. However, compared to shaving, waxing requires less frequent upkeep because the effects endure longer. Shaving can be done every day if necessary and is faster than waxing. It is easier to do at home and requires less equipment, making it more convenient. You also have to wait for your hair to grow out sufficiently to get waxed again before getting another wax. Shaving allows you to shave stubble as soon as it appears. Cost. Waxing by a professional can be costly, particularly for major body areas. Actually, a full body waxing treatment often costs between $152 and $280. Although home waxing kits are less expensive, they eventually cost more than shaving supplies. Shaving is typically less expensive because only razors and shaving supplies are needed, but buying good razors and replacing them often can get expensive. Suitability for different areas. Every part of the body can benefit from waxing, even delicate areas like the face, bikini line, and underarms. Additionally, it works especially well on larger regions like the back legs and chest hair. It is also the best option for smaller regions like the eyebrows because it can precisely shape and remove hair. Though it can be applied to any area of the body, shaving is most frequently done on the legs, underarms, and facial hair. Because of the increased risk of irritation and ingrown hair, it is less appropriate for places like the bikini line. If you are liking our videos, please subscribe our channel for more quality content like this one. When is waxing not suitable? Although waxing is a safe and effective way to remove hair, it might not be appropriate for everyone. The following categories of individuals ought to refrain from waxing or get medical advice before doing so. People with sensitive skin or skin conditions. After waxing, people with extremely sensitive skin may experience redness, swelling, or discomfort. Be cautious during waxing if you have sensitive skin. Waxing should also be avoided if you have rosacea, psoriasis, eczema, or other chronic skin conditions because it might exacerbate them and lead to flare-ups. Finally, since waxing can exacerbate sunburn and further damage the skin after sun exposure, it should never be applied to burnt skin. Individuals using certain medications. Waxing should be avoided if you're on any certain drugs or topical treatments, just like retinoids. Using topical or oral retinoids during waxing might increase skin sensitivity and make it more vulnerable to tearing or injury. Blood thinners. Individuals on blood thinners, such as heparin and warfarin, may be more prone to bleeding and bruises after getting waxed. Antibiotics. Certain antibiotics make the skin more sensitive, which might cause negative responses when waxing. Tetracycline, minocycline, and doxycycline are a few of the medications that might irritate skin. People with certain health conditions. Waxing might not be the best option for you if you have any of the following conditions. Diabetes. When waxing, those with diabetes may heal more slowly and have a higher risk of infection. Varicose veins. People with varicose veins should refrain from waxing on or close to the afflicted regions to avoid irritation and consequences. A compromised immune system. Individuals who take medication or have medical disorders that impair their immune systems may be more susceptible to infection from small injuries from waxing. Pregnant women. The skin becomes more vulnerable to discomfort, redness, and irritation from waxing during pregnancy. Pregnancy-related hormonal changes in women can also have an impact on the skin's reaction to waxing and the patterns of hair growth. It is advisable to see a doctor before waxing if you are pregnant. If you've had recent exfoliation or skin treatments, if you've recently had chemical peels, microdermabrasion, or other abrasive procedures to exfoliate your skin, stay away from waxing. These procedures may increase the skin's sensitivity and vulnerability to waxing-related harm. In order to protect your skin from further harm, you should refrain from waxing in the regions that you have recently had laser hair removal or skin resurfacing treatments. To prevent skin sensitivity, wait at least 4 to 6 weeks after these treatments before waxing. If you've had allergic reactions to waxing, certain components of wax, such as perfumes, resins, or preservatives, may cause allergies in certain persons. It is advisable to refrain from waxing again if you have previously experienced an allergic reaction to wax, as these reactions can be hazardous. Individuals who have recently had surgery. Waxing over wounds or places that have recently had surgery should be avoided, as this might lead to discomfort and infection. I hope you learned a lot, and for more content like this one, please subscribe our channel. Thanks for watching.